If you're over 60, or if you're helping care for an aging parent, spouse, or family member, there's something important I want to share with you today. Most people think the biggest concern during a hospital visit is the medical issue that brought them there. But over the years, many families have discovered that some of the most stressful problems begin after the treatment starts. Unexpected bills, confusing paperwork, questions nobody explained clearly, decisions made quickly while you're tired, worried, or focused on getting better. And here's the difficult part. Many intelligent, careful people find themselves facing these situations, not because they did anything wrong, not because they weren't paying attention, but because nobody told them what questions to ask before signing forms or agreeing to certain decisions. Today, I'd like to walk you through 5 common hospital situations that every older adult should understand before their next hospital visit. My goal is not to create fear. Most healthcare professionals genuinely want to help their patients. But healthcare systems are complex, and understanding a few key details can help you make more informed decisions for yourself and your family. As we go through these examples, I encourage you to listen carefully and even take a few notes. Some of the questions we'll discuss could save you significant stress later. Let's begin with the situation that surprises many people the most. Number 5. The specialist you never expected. Imagine this. You spend time researching hospitals. You check with your insurance provider. You confirm that the hospital is included in your network. You feel confident that you've done everything correctly. Then several weeks later, a bill arrives. The charge isn't from the hospital itself. It's from a specialist whose name you barely recognize. Perhaps it was an anesthesiologist involved during a procedure. Maybe it was a radiologist who reviewed imaging results. Sometimes it's an emergency room physician who briefly participated in your care. Many people are surprised to learn that while a hospital may participate in their insurance network, individual providers working within that hospital may have different arrangements. This can create confusion, especially when patients assume that everything associated with the hospital falls under the same coverage rules. Fortunately, patient protections have expanded in recent years, and there are steps you can take to better understand who is involved in your care. One of the most useful questions to ask before treatment begins is, "Can you confirm whether the providers involved in my care participate with my insurance plan?" It's a simple question, but many people never think to ask it. You can also request information from the billing department if anything seems unclear. The more information you gather before treatment, the fewer surprises you may face afterward. And I'm curious about something. Have you ever received a medical statement or bill that left you confused about where the charge came from? Many viewers have shared stories about opening an envelope weeks later and wondering whether a charge was correct or why it appeared at all. Experiences like that often teach us the importance of asking questions early rather than trying to solve problems later. Now let's move to the next situation, and this one can happen when people are at their most vulnerable. Number 4. Feeling rushed. Before you're ready. A hospital stay can be exhausting. Even after a successful procedure or treatment, many older adults need time to regain strength, confidence, and mobility. Yet sometimes patients feel pressure to leave before they believe they are fully prepared. Perhaps a doctor says you're making good progress. Perhaps a discharge plan is presented sooner than expected. Perhaps your family still has concerns about your ability to manage safely at home. These situations can create uncertainty. Most people naturally trust medical recommendations, and in many cases those recommendations are appropriate. However, it's also important to remember that patients have the right to ask questions and seek clarification if they feel uncomfortable about a discharge decision. One helpful question is, can you explain why discharge is being recommended at this time and what support options are available if additional care is needed? That question opens a conversation. It encourages the care team to discuss rehabilitation services, home health support, therapy needs, and other resources that may help with recovery. Families often tell me that the most valuable thing they did was speak up when something didn't feel right. Not in a confrontational way, not by arguing, simply by asking thoughtful questions and making sure they understood the plan. Sometimes that conversation provides reassurance. Other times it reveals options that might not have been discussed otherwise. Either way, asking questions helps you make informed decisions. And when it comes to your health and recovery, informed decisions matter. Number 3, medication changes you may not notice. Now let's talk about something that often receives very little attention during a hospital stay, yet it can have a significant impact on how an older adult feels during recovery. Your medications. Many people over 60 take medications that have been carefully adjusted over time. Perhaps you've been taking the same blood pressure medication for years. Maybe your thyroid medication was adjusted gradually until the dosage worked well for you. Or perhaps your doctor spent months finding the right combination of medications to support your health. When you're admitted to a hospital, however, the facility may use its own pharmacy system and medication inventory. In some cases, the exact medication you normally take may not be available. When that happens, healthcare providers may use an alternative that they believe serves a similar purpose. Sometimes patients are informed clearly. Sometimes they don't fully understand that a change has occurred until later. This is why maintaining an updated medication list is one of the smartest habits older adults can develop. Keep a written record of the medication name, the dosage, how often you take it, and any important notes from your physician. Store a copy in your wallet, your purse, or even on your phone. Then, whenever you're admitted to a hospital or attending an important medical appointment, bring that list with you. One helpful question to ask is, can we review my current medications together and discuss any changes before they are made? That simple request creates an opportunity for communication. And communication is one of the most effective tools patients have. The more informed you are, the easier it becomes to participate in decisions about your care. Now we're about to discuss the issue that catches many families completely off guard. In fact, this next situation often begins within minutes of entering the hospital, and most people never realize what they agreed to until much later. Number 2, signing forms. Too quickly. Picture the scene. You arrive at the hospital. You're worried. You may be uncomfortable. A family member is concerned. Staff members are moving quickly. Then someone hands you several pages of paperwork. There are signatures needed here, initials needed there, privacy notices, consent forms, insurance information, financial documents. For many people, the natural response is simple. Sign where indicated and move on. After all, who wants to sit and read multiple pages of paperwork while dealing with a health concern? But this is exactly why taking a few extra moments can be so valuable. Whenever possible, slow down. Read carefully. Ask questions. And if something doesn't make sense, request clarification. Many older adults tell me they felt uncomfortable asking staff to explain a document because they didn't want to cause delays. Please don't feel that way. You have every right to understand what you're signing. In fact, asking questions is one of the most responsible things you can do. A useful question might be, can you explain this section in plain language before I sign it? Most staff members are accustomed to answering these questions, and sometimes a 2-minute conversation can prevent weeks of confusion later. I often recommend that families designate one person to help review paperwork whenever possible. A spouse, an adult child, a trusted friend. A second set of eyes can be incredibly helpful, especially during stressful situations. The goal isn't to create suspicion. The goal is simply to understand what you're agreeing to before you sign. And now we come to the final point. This may be the most important topic in today's discussion because it affects more people than most realize. Number 1, Understanding your hospital status. Many older adults assume that if they are placed in a hospital bed, receive treatment, and stay overnight, they have automatically been admitted as an inpatient. But sometimes the situation is more complicated than that. Hospitals may use different classifications for patients depending on their medical circumstances. Because of this, it's important to understand exactly how your stay is being categorized. Why? Because certain insurance benefits and post-hospital care options may depend on that classification. Unfortunately, many patients don't discover this until after they leave the hospital. That's why one of the most important questions you can ask is, can you explain my current hospital status and what it means for my coverage and future care? Notice how simple that question is. You're not challenging anyone. You're not creating conflict. You're simply requesting information. And information gives you the ability to make informed decisions. If anything about your status is unclear, ask for additional explanation. If paperwork is provided, read it carefully. If family members are involved in your care, encourage them to understand the information as well. The more clarity you have during your stay, the fewer surprises you may face afterward. Before we finish, I'd like to leave you with a simple action plan. Tonight, take a few minutes and write down these 5 questions. Can you confirm whether the providers involved in my care participate with my insurance plan? Can you explain why discharge is being recommended at this time? Can we review my medications together and discuss any changes before they are made? Can you explain this section of paperwork before I sign it? Can you explain my hospital status and what it means for my future care and coverage? That's it. 5 simple questions. You don't need to memorize complex policies. You don't need to become an expert on healthcare regulations. You simply need to know which questions to ask. People who ask thoughtful questions often feel more confident. They understand their options better. They communicate more effectively with healthcare providers, and they are often better prepared for the decisions that follow. If you're over 60, or if you're helping care for someone who is, I encourage you to save these questions somewhere easy to find. Keep them on your phone. Write them in a notebook. Place them with important medical documents. A few moments of preparation today could make future healthcare experiences far less stressful. And remember, the goal isn't to worry about every possible problem. The goal is to stay informed, stay prepared, and stay involved in decisions that affect your health and well-being. In our next discussion, we'll talk about what happens after a hospital stay and the important questions families should ask when rehabilitation services, recovery programs, or long-term care options enter the picture. That's an area where many families feel overwhelmed, and understanding it ahead of time can make a tremendous difference. Before you go, if you found this helpful, consider subscribing to the channel. Each week, I share more practical insights like this to help older adults and families navigate healthcare, daily decisions, and life situations with more confidence and clarity. I'd also love to hear from you. Leave a comment below. Have you ever experienced a confusing hospital moment, or is there a topic you'd like me to cover next? Your experiences may help someone else who is going through something similar right now. Until then, take care of yourself, stay informed, and never hesitate to ask questions when it comes to your health.